Hi everybody, this is Julissa. Thank you so much everybody for coming back to my channel. Thank you to everybody who listens in the podcast. It is Tuesday, June 25th, 2024, and I wanted to come here and speak about this case. I have read about this in the news and I was like, wow, this is crazy. And if this is not another sign of the ends of times, I don't know what is, right? This is We're living in the days where evil is being called good and good is being called evil, meaning if you're standing up for something that's pure, that's something that is right, something that's defending other people, you might be seen as a controversial person and there might be people after you, right? So this is just another sign of the ends of time, guys. In case you haven't heard, there's a doctor right now who was indicted by I think it was by the federal court, right? He was indicted by the federal court last summer because he realized that he discovered that there was a treatment being done in a children's hospital where he worked for that supposedly was supposed to end, but it continued out of, I guess you can say, out of secrecy, and now he's being called a whistleblower and saying that he violated the HIPAA law, right? And we understand, I mean, for my understanding, the HIPAA law is when you if you have access to somebody's medical records, it's not, unless you have permission, you're not allowed to disclose that information, right? Meaning, like, you cannot just walk into a doctor's office and to have to you show up and then you hear two of the receptionists talking about your health record without your permission or giving information. Somebody calls your doctor's office on your behalf and immediately they're giving personal medical information about you without you signing a release form. That will really get people in trouble, and that's against the law. But for my understanding, I always believe that a doctor, I mean, they are basically, they have the access to any records that they need, right? For research, especially if there is related to their patients, right? For research, and if the saying that goes around these days is, if you see something, say something. So if you think you are at a workplace where you might have come across something that is being done and you know it's against the law, what are you as a human being working for any company should be doing? You should be reporting that. But this doctor got in trouble, and right now he's facing almost 10 years in jail because they're saying that he broke the HIPAA law and he should have never spoken about anything or being a whistleblower, right? I think there's more to this case than they want to share. Everybody who comes against this whole agenda that we know they're pushing to the children is going to be deemed a person who is, who is against their agenda. Anybody who comes against the agenda, not like saying they don't like it, but like discovering things that it should have never have been done, especially to children, they are gonna call that person controversial, and that person will get in trouble, and basically their life will be ruined. And I know there's another, I think it's a nurse who's also got herself in trouble. I don't know if the two cases are related, but today I'm going to talk to you about Dr. Ethan Haim, I believe that's how you say his name. So let me just read to you this briefly in case you haven't heard this story, because it's shocking that this is not really like going all over, like like trending on the internet. It's almost like we're gonna make him pay for what he done, but we're gonna keep it kind of like silence a little bit. That's another sign of the ends of time, right? A Texas doctor who called himself a whistleblower on transgender care for minors is accused of illegally obtaining private information on patients from the nation's largest pediatric hospital who were not in his care. Okay, first of all, I came here and talked to you guys about Miss Rachel. A lot of people didn't like what I said, but I said Miss Rachel, the famous YouTuber who has a TV show catered to an audience that barely speak, right, to children. is celebrating this whole alphabet day, right? That is celebrated this whole month, right? In June is celebrated. And I couldn't understand the reason behind that because, you know, no child, like there is no mom right now who is looking at their baby in their arms and saying, oh, my kid is going to be this or the other, right? Um, why are they catering that type of stuff to children who don't even have the knowledge, who don't even speak yet? So this doctor noticed that something is being done, this whole transgender care for children in the biggest hospital in the United States. And this whole program was supposed to be over with, and he noticed that it's still being done under the table, I guess you can say, right? This whole treatment is being done for children, transgender care for children. And he said something about it, and now he's in big trouble. And that's crazy, guys. It's just, I mean, there are people right now talking about it online. I was reading before I came here and make this video. I read some people's comments just to kind of feel what people think about it. And people are saying how dare this doctor goes out and go against the whole transgender community. That's not even the point here. He wasn't going against it. It's basically saying this is how I looked at it, right? And you guys know my stand when it comes to the alphabet, right? I don't want to get too much into it, but me being a creator, I always put it in this perspective. I'm not going to spend 6 months, let's just say, creating a whole collection, creating a whole garment, buying the fabric, designing it, buying the fabric, doing the pattern, doing the fittings, and all of that. So when I have my final thing, I'm gonna call it something that is not right. I'm gonna call it something that was not my ideal intention. And if I see somebody saying, you know, that dress that you made, I made it into pants, I'm gonna be like, I don't even know who you are. Like I didn't make that. So don't go around saying that I made it because that's not what I made, right? That's just my opinion, my whole kind of like idea behind being a creator myself. And if that's just me, like this little person, imagine God, right? I always think about that. God is not going to equip something to call it something that is not. Please, this is just my opinion on it, right? But it's so crazy. What I believe this doctor was trying to say, hey, this whole treatment that supposedly was supposed to end is still being done, right? I don't think he was going against the whole treatment and what they're doing. I'm 100% against it. Like I said, I don't think any child in whatever age of a child has any knowledge of what, you know, of saying something that, oh yeah, I might have this, but I want to believe that I'm something else. I don't think they have they don't have that knowledge yet to even think of something like that. So if they don't even have the knowledge, that means they're being influenced, their parents are being influenced, and some type of I know people are gonna hate it, but some type of abuse happened there that a child will ever think like that, right? That's why, like I said many times, and I don't want to get off topic, but children, you have to know who you leave your children with, right? You might go to work for 8 hours and you have this babysitter, this daycare person who wants to be cute and is going to make your child wear a costume that is meant for a girl, right? And say, well, he looks so cute and we were just doing a play, we were just doing some type of comedy, right? And so it begins, right? Because he gets applauded now, this male child gets applauded and celebrated by wearing a woman's dress as a play, as a joke, as whatever. And then he's like, you know, it makes him feel good because he's being embraced, he's being celebrated, he's being applauded. Everybody's welcoming him because he's so funny. And he begins there, right? And then they want to seek that more and more. And, you know, before you know it, they're playing with mom's, you know, heels, and they want to wear mom's purse all the time. And then It's like, oh, you seems to like a lot of your sister clothing. Perhaps you're this or the other, right? And so it begins, right? You have to pay attention and show up. Some days you don't have to be always on schedule. Show up early to the daycare, right? Show up on a day that on a time that they're not expecting you. See what's going on. And if you have somebody babysitting for you at home, have your cameras. You as a as a responsible parent, and as the care being done, especially in your house, you have every right to know what's happening in your home, right? So if somebody has a problem with the cameras being there, then they're not the right person for the job, right? We have to be so careful who we leave our kids with, right? So going back to this doctor and what he did, so he noticed this was being done, this whole procedure was still being done, and he said something about it. And now he's basically his whole career is being over with, and he's facing 10 years in jail for this. So let me continue to read. Federal prosecutors say Dr. Ethan Haim, a 34-year-old surgeon, snatched the information and shared it with a conservative, I can pronounce that, shared the information with a conservative activist with the intent to cause malicious harm to Texas Children's Hospital in Houston. Haim pleaded not guilty on Monday in federal court to 4 counts of wrongfully obtaining individual identifiable health information. I mean, who sues a doctor for going over records for a patient in the same company that he works for? Like, I don't understand. Like, I don't understand. Is this even even allowed? Out of anything, right? Out of anything, this should be like, if you're telling me, like, let's just say an office manager, or like a person who comes in and does the shredding or something, access a computer and saw information about patients, but a doctor, a, a, a surgeon, like probably the head of surgeons in that hospital, noticed something about patients and something that is being done, some type of treatment, and then he gets in trouble for that. That is crazy. It wasn't like the receptionist who's like checking information about a patient who she didn't have any contact with. It's a doctor who has every right to do that, right? Because you know what's crazy? The moment one of those children or their family calls, like, right, their family calls for like a refill or whatever, right? And then this patient, the doctor that they normally see, right, is not available. So they pick another doctor who's probably the head of whatever, whoever is covering that day. And that doctor is allowed to do so many things for that patient because the other one is not there. But now, because he was able to look at the records, now he gets in trouble. I think the issue is that he discovered something that was not meant to be discovered, and he says something about it, right? He didn't just saw it and was like, oh, you know, we're being lied to. They're lying to families. They're lying to the media. They're lying to this. Oh, anyways, let's continue on with life. He actually says something. He saw something. He says something, and now he's in trouble, right? Sometimes you like, really, do they really want you to say something? Really? Um, he says he previously did some work at Texas Children's Hospital as part of his residency. The indictment against him alleges that in 2023, he asked to reactivate his login there to access information on pediatric patients not under his care, including names, attending physicians, and treatment codes, then turn over the information to a media contact. Haim was publicly identified himself as the person who gave the information about the patients at Texas Children to a conservative activist who published a story that the hospital was providing transgender care to minors in secret. Providing transgender care to minors in secret. A minor who doesn't even know, like, I'm telling you, man, we are definitely in the last days. I know people are gonna say many things about this, But they're trying to normalize something that is completely against God. And when you say something about it, then you get in trouble for it. Tell me we're not living in the last days, guys. So this hospital was doing this in secret, and the doctor was able to notice that, and he said something to the media, right? He said, Texas lawmakers banned transgender care for minors in September of 2023, and that law is being challenged in court. At least 25 states had adopted laws restricting or banning gender-affirming medical care for transgender minors, and most of those states face lawsuits. Haim, this is the doctor, right? He faces up to 10 years in prison and a $250,000 fine if convicted, and he was just released on a $10,000 bond. He actually had a court appearance last week, and he said, I have maintained from day one that I have done nothing wrong. We're going to fight this tooth and nail and stand up for whistleblower everywhere. He said this outside of court last week when he had an appearance. Texas children declined to comment on the changes against Haim. In previous statement, hospital officials said its doctors have always provided care within the law. So this is crazy. He's being punished for sharing something like that, but and they want to use the HIPAA law against him, even though he's a doctor. He has any doctor working for any place, like any clinical or hospital place, they immediately get access to any patients, right? Um, like I said, if it was like a person who's not even like related to like the office space, let's say somebody who goes as a vendor, who goes to the office as a vendor, even like a custodian staff, that would make more sense. But a doctor, a head doctor at that hospital, going through some patients' charts and seeing something that he knew that the hospital said they were no longer doing, I don't think he did anything wrong here. When he spoke to the media about it, he didn't share, this patient, so and so, date of birth, and the name and the family name, and at this day they shared this and the other. He never did any of that. He's basically saying, hey, this hospital is doing something that they're saying to everybody that they're no longer providing because it was banned in Texas. That was banned. That's the reason why he says something. So imagine working for a corporation where it's basically going against the law. You might want to say something, right? But he's being punished because what he discovered is something that is everything that they're trying to push these days, right? So let me know what you guys think about this. Thank you so much, everybody, for coming back to my channel. And thank you, everyone, for listening to the podcast. Have a good day. God bless.